Hello guys, this is Dr. Celine Kuo, and this is What's in My Bag. This laptop, it's so emotionally attached. So at that time, it was 2016, I was recruited by NYU as the clinical assistant professor. As for full-time, they gave me this $3,000 of the stipend for me to purchase electronic devices that I use it to complete all the project. So that's why I hope it could stay with me for the past another 10 years and also past 10 years, of course. So I got this product from a very close friend. This is released in Japan, and I guess we will one day get it in Taiwan. What's important is it's not an ordinary refreshment. It's actually the refreshment that you can put in your mouth to keep your mouth really refreshed, smells good. But most important is this product, it could start to stimulate your salivary gland, which is the saliva that could be generated. So this formula is patented by this brand, and hopefully we could get it someday soon. Stay tuned. Starting from February, I went to a special private tour in Straumann headquarters. So I went into the pharmacy and tried to get myself a more moisturizer. Like the texture was so good, and your skin just resorb immediately. You will feel the texture, and it absorbs immediately, make your skin like silky smooth. I came from a family that we have many doctors at home. So as a family rules, always carry antibiotic. Whenever you will need or your friends will need it, just come to get me. It was actually a collab from Straumann along with this premium toothbrush type of brand called Curipax. I'm gonna show you what's in this little kit. The brush itself, it was just so dense, and it was actually soft, but also it wouldn't harm your tooth or your gum. Comes with this cute little toothpaste, comes with different flavor that I use always. So this floss, it was actually from 3M, this large brand that I constantly use and I introduce to my patient all the time. This floss actually gives a really good balance to going through the contact, giving enough cleansability to really remove those mushy stuff that could cause decay. I have been adopting a lot of digital tools plus software into my treatment. So with the technology, I would say starting from the aesthetics, the patient could receive photos or even three-dimensional facial scan, along with the intraoral scan of your teeth. That starting from planning of your teeth, we can actually superimpose these two information and really use your smile to design your teeth, finishing up with the different softwares to design for the best rigidity, longevity for the material. Has really been beneficial for all the patients. The term prosthodontics, it was actually the Latin origin from prosthetics, which is something substitutable. So whatever it's been used for substituting your own teeth, regardless, removable denture or implant crowns or a tooth-supported crowns, these are all called prosthetics. So this knowledge is called prosthodontics. For the prosthetic work, which is your teeth, to be able to use with longevity, which is the long-term success. So my mentor, Dennis Charnow, used to tell me, say, wherever you go, you have to spend at least 3 years to plant your root there. I have decided at that time I want to come back to Taiwan. He was actually disappointed. And he was teasing me, saying, why are you going back to this third world? But I told him, that's my hometown. We have our semiconductor, we have our AI technology that has been evolving, especially in Taiwan. There will be anywhere less compared to my hometown. Convenience store, nothing can compare, okay? Rating from store, always 10 out of 10. If it's rating from convenience store, not acceptable. Thanks to Straumann Group having me today. As for final, I would like to end up the session with the quote from Steve Jobs, and that's also my life quote. Stay hungry, stay foolish. Always prepare myself as a beginner when learning something, especially something innovative. So I'll see you next time. This is the Lingual. Take care.